I have a bachelor's in biology and a master's in public health. I specialize in community health and public health education. I have worked in hospitals and community organizations developing programs that promote positive health outcomes. During the final year of my master's in public health degree, I went to the Gambia, which is a little country in West Africa of about 2 million people, to study their healthcare system. Many years later, my husband and I built an affordable college there. Thus far, we have graduated about 200 students in various disciplines. First, let me say, there are many dimensions to health. This includes social, emotional, spiritual, environmental, occupational, intellectual, and physical. Physical health is influenced by many things, especially a family's tradition and belief system, as well as their environment and access to health care. In the Gambia specifically, they have 2 seasons for farming, the rainy season and the dry season. Years ago, the rainy season started in May. Because of this, people can have an early harvest of some of their crops in about 3 to 4 months, which would be in the months of August and September. Now, however, the rainy season does not start until mid-July. Those early harvested crops can no longer be planted because they will not be able to grow in the colder temperatures of October and November. Rice is a staple in the Gambia and in most of West Africa. Rice is grown in swampy areas. Today, many of those swampy areas have dried up due to the lack of rain. This can cause food insecurity in the country. In addition, families will not have rice to sell and therefore will not have an income. Well, in the case of rice, because the fields have dried up, people do not have rice to eat, nor do they have rice to sell. This leads to malnutrition. In addition, people can no longer pay the school fees for their children. This can lead to an interruption of education and ultimately illiteracy. Because the rice fields are dried up, people will leave the villages and move to the cities to look for work. This leads to overcrowding, which is a hotbed for the spread of infectious diseases. It's a vicious cycle. Some countries in Africa lack the infrastructure to support the health needs of its citizens. They may not have a developed healthcare system. In addition, when there is a lack of food, some countries may not have a welfare system or safety nets in place to provide for their citizens in cases such as these. In my opinion, education is a key component to improving health outcomes in Africa. Health education ranges from individual and family health to training and educating health professionals. Many times, however, there are trained health professionals, but medical equipment is not available to perform surgeries or to administer treatment. This is where other countries could be of assistance. In addition, it is important for industrialized countries to reduce their carbon footprint.